Hello, Dr. Smith. Thanks so much for taking the time to discuss your practice with us. Why don't you start by telling us a little bit about yourself?
Hi, I'm Kevin Smith, MD. I'm double board certified in anesthesiology and in pain medicine. I've been practicing medicine for more than 30 years and practicing regenerative medicine therapies utilizing PRP or platelet-rich plasma for more than 10 years.
What is regenerative medicine, and what inspired you to start practicing it?
Well, regenerative medicine is where we use various techniques and tools to repair, regenerate, and rejuvenate many bodily tissues. I've always been a very curious physician, and Western medicine is very traditional. And I started hearing about regenerative medicine therapies that can actually be curative in some instances. So I became interested in it and started performing it.
You mentioned platelet-rich plasma, or PRP. What is that?
Platelet-rich plasma is when I essentially remove your blood. I place it into a centrifuge, and that centrifuge spins your blood down and it separates it into red blood cells, platelet-poor plasma, and there's a buffy coat in the center. That's where the platelet-rich plasma is located, and that's the tool that we utilize.
What type of PRP procedures do you perform?
A little over 10 years ago, I started primarily treating spine and major joints. So that includes the knee, the hip, the shoulder, and the lumbar spine or the low back. I've had and continue to have great success with these treatments. Oftentimes, we're able to postpone and or prevent the need for surgery. Because our results have been so good, I started thinking, what else can I use platelet-rich plasma for? And about that time, I met a Dr. Charles Runnels, who's the inventor of all the vampire procedures that you've seen advertised. Now, in addition to the spine and joint procedures that I perform, we offer the O-shot. The O-shot is a treatment that we use for female urinary incontinence. And as a side effect, you can experience sexual enhancement. The P-shot's used to treat male erectile dysfunction and Peyronie's disease. There's the vampire hair restoration that we use to treat balding and thinning hair loss in men and women. There's the vampire facial. We use that to improve color and texture of your skin. There's the vampire facelift. That improves color, texture, size, and shape of your face. And then lastly, there's the vampire breast lift that we use primarily to improve the shape and sensitivity of your breast. All these procedures are very effective and we're having a lot of success with them.
Do you perform all of these in-house?
I perform all these procedures myself here in my office.
I've heard these can be uncomfortable procedures. Do you consider them painful?
No, not at all. The techniques that I utilize with my background in anesthesiology and interventional pain medicine, I'm able to perform all these procedures with very little, if any, pain at all. My staff are trained very well, they're very helpful, they understand the procedures, and they're here to keep you comfortable.
Is there anything else you'd like to add about PRP or your practice?
Regenerative medicine is a very exciting and evolving practice of medicine, and I like to stay on the forefront of this. And I'm just glad that I can offer these therapies through my office.
Thank you so much for your time, Dr. Smith.
Thank you.
For more information, contact Regenerative Medicine and Biologics Institute at 858-633-4141 or send an email to info@rmbinstitute.com or text REGEN to 42828.